iHeart is a self-administered, shared decision-making tool that screens and treats cardiac patients for depression. iHeart supports clinics by screening patients for depression and anxiety prior to their visit with you, activating patients to discuss their symptoms and to improve attendance to their mental health visits, sending you an iHeart summary report of cardiac symptoms, adherence, and preferences to mental health treatment, providing medication management tips, triage, and referral support, bypassing the doctor so patients can directly refer themselves to mental health resources. This study will determine whether automated shared decision-making tools that activate patients and providers alike can improve depression treatment uptake and symptoms in real-world settings. Why is depression a problem in cardiac patients? Depression is common. 40% of heart disease patients experience elevated depressive symptoms. Depression predicts poor patient outcomes. Even mild depressive symptoms are associated with worse cardiovascular outcomes. Yet, CHD patients are even less likely to engage with depression treatment than a standard patient. Many providers don't realize that depressed cardiac patients need at least 2 types of treatment: cardiac rehab, medications, and/or therapy. Guidelines recommend that providers screen for depression, provide psychoeducation and shared decision-making, and connect patients to treatment. However, providers often lack the time and support to do this. In our healthcare system, we found that routine screening alone, without an activation tool, markedly underestimated the number of depressed CHD patients. How does it work? Your patient will receive the tool by email, text, or in person before their medical appointment. They will then complete the personalized tool with help from the iHeart team. iHeart provides mental health assessment, personalized education and patient activation, guidance and treatment selection, and treatment matching support. iHeart was designed with input from patients and providers, including cardiologists. This tool has exceeded established usability thresholds and undergone several rounds of rigorous usability testing. User testing in English and Spanish was conducted in a diverse population of patients, including elderly and low literacy individuals. iHeart Depth Care isn't just one more thing for you to do. Our study team will call patients, connect them to the tool, and provide you a summary report with suggested next steps. Use the iHeart Depth Care Smart Phrase to add depression and anxiety screening and plan to your note. Whether or not you prioritize discussing depression with your patient during the visit is up to you. But just hearing providers like PCPs and cardiologists acknowledge stress and depression as a treatable illness that affects heart health can activate patients to seek out treatment and improve cardiac outcomes. Even patients who are already on treatment for depression may benefit from interventions from their providers. You should now have a better understanding of iHeart and how it works. We hope this tool can help you screen and treat your patients for depression, as well as improve patient-provider engagement. For more information, contact Dr. Natalie Moyes,